Coming to question 24 of previous year NEET PG 2024. So this is also image based big question. The question is, what's the gold standard test? So the scenario is a 55 years female presents with abnormal movements of upper limb for the past 3 months. She gives history of jaundice and history of taking native medicines for the same for the past 1 year. Her eye examination showed case of Fleischer ring and icterus. And I think the image is quite clear. There is a brown ring around the cornea. So this is Fleischer ring. There are some abnormal movements. Plus there is jaundice. So clearly this is Wilson's disease, because Wilson's disease is also called as hepatolenticular degeneration. We know very well Wilson's disease is an autosomal recessive disease associated with a problem with copper transport in the body. So excess copper gets deposited in tissues. So it is actually a problem with copper transport. Ceruloplasmin is the copper storage protein in the body. Ceruloplasmin. So ceruloplasmin gets reduced. So usual level is less than 25 milligrams per deciliter. As a result of copper transport protein, when ceruloplasmin becomes low, copper gets excreted in urine. So urinary 24-hour copper becomes increased. But the hallmark is the excess copper in the blood gets deposited in many organs, especially the liver and the lens. Lens is actually basal ganglia of the brain. So when it deposits in the liver, it causes jaundice or liver failure. Remember, Wilson's disease is one cause of, other than alcohol and other than fatty liver disease, Wilson's disease is one cause of cirrhosis. And when it deposits in basal ganglia of brain, it causes abnormal movements. Usually they say the typical movement disorder is wing beating tremors. It's a coarse tremor of the upper limbs. Of course, any movement disorder, any dystonia can occur with Wilson's disease, but the classical one is wing beating tremor. Since image based questions are common, wing beating tremor may be kept, the same scenario may be asked, and we may be asked to diagnose Wilson's disease. This question, though it is big, the answer is straightforward. It's a case of Wilson's disease. The question is, what's the gold standard test for Wilson's? I already told you serum ceruloplasmin levels becomes low in Wilson's disease, less than 25 milligrams per deciliter. We can say that it is an investigation of choice. 24-hour urine copper excretion. Usually these two are done together. Urine copper, 24-hour copper excretion becomes increased. This is also the investigation of choice. These two are usually done together. But the question is gold standard. To prove Wilson's disease, there should actually be liver biopsy for copper level estimation. The dry weight of the liver to measure for copper should be done. This is actually the gold standard. So this is a theoretical question. Usually it is not done. It is diagnosed from other things. MRI brain shows a feature which is giant panda appearance. As I already told you, the copper gets deposited in the basal ganglia. That looks like a giant panda. I'll show you the images. One thing to note from this history is, remember, the patient initially had jaundice initially, then only she developed a movement disorder. So neurological findings do not come first in Wilson's disease. Jaundice or cirrhosis comes first and neurological findings comes last. The final treatment here is liver transplant. There are some drugs like D-penicillamine, zinc, triamterene. So these are some drugs which are used in Wilson's disease. But once cirrhosis sets in, we need liver transplant. But once brain changes occur, liver transplant is contraindicated, means there is no use in doing liver transplant. So the gold standard for Wilson's, liver copper estimation, investigation of choice, serum ceruloplasmin and 24-hour urine excretion. We have to remember two storage diseases. This is Wilson's. This is a disease called NBIA. brain iron accumulation. Neurodegeneration with brain iron accumulation. It's called Haller-Walden's disease. Don't think of the details. This is the region of basal ganglia actually. You can see multiple deposits here. See, it looks like the panda's face, giant panda face. Okay, if you are able to appreciate. Whereas see this one, you can see some deposits here inside. So this looks like a tiger eye, right? Okay, so just thinking from your mind. Wilson's causes giant panda face appearance, and Haller-Walden's disease causes tiger eye appearance. Few other MRI is also important in neurology or in radiology from NEET point of view, like that of Parkinson's disease, okay, and Parkinson plus syndromes. If questions comes, I'll show you those images also.